Bismillahirrahmanirrahim. So I welcome you all to this video tutorial in which I will discuss the topic of the nephrotic syndrome. That what is actually the nephrotic syndromes, as the name indicate the nephrotic mean there may be some problem within the structural and functional unit of the kidney that is called the nephron. So first of all, I will go toward the slide background of the urine formation that involve the three main steps, that is the glomerular filtration, and then the selective reabsorption, and then the tubular secretion. And then I will give a touch to the definition of the nephrotic syndrome and what happened during the nephrotic syndrome, due to which a large number of protein is excreted in the urine, especially more than 3.5 grams per liters for 24 hours. So that is called the nephrotic syndromes. So first of all, if I draw the normal nephron structures. So suppose this is the Bowman capsule of the nephron, and then this is the proximal convoluted tubule, and then this is the descending and the ascending limbs of the loop of Henle. So this is suppose the loop of Henle. And then this is the distal convoluted tubule, and finally the collecting duct in which the urine is collected. So this is the normal structure of the nephron. So normally जो है जब urine formation होती है तो first of all in every cardiac output approximately 20 to 25% of the blood is pumped toward the kidney, जो कि that proportion is approximately 600 ml fluid is then passed from the efferent arteriole toward the efferent arteriole, and only a small portion is filtered into the glomerulus, that is the bunch of capillaries within the Bowman capsules. So among the 600 ml fluid, only 120 ml is then filtered to the Bowman capsules, and then pass from the Bowman capsule glomerulus to the distal convoluted tubules. So 120 ml fluid will be filtered in every cardiac outputs, but from that 120 ml, the 119 ml is reabsorbed, and then only 1% is passed to all these remaining parts of the nephron, and only 1 ml is passed in the urine. So this is the normal process. First of all, the glomerular filtration occurs, and 120 ml fluid is filtered into the glomeruli of the Bowman capsules, and then there is the selective reabsorption, in which 119 ml and different other essential elements and etc. are reabsorbed again, and only 1% passed in the urine and only 1% fluid passed as a urine. So this is the normal process. Now, what happened during the nephrotic syndrome? There may be some problem within these nephron structures, or due to some infectious disease, or due to some cancers. The glomeruli of the nephron is damaged, due to which a large number of proteins that is not normally not filtered through the glomerulus is passed into the glomeruli and then excreted in the urine, and whose range is approximately 3.5 grams of the protein when it is excreted in the urine per liter and the 24-hour interval. So that will be called as the nephrotic syndromes. But in contrast, we compare the nephrotic syndrome with the nephritic syndrome. That is the other condition. So mainly जो है nephrotic syndrome में a large number of protein is excreted in the urine, while in case of the nephritic syndrome, इसमें जो है a large number of the blood cells are excreted in the urine, that is called the hematuria. So the main feature of the nephritic syndrome is the hematuria, while the main feature of the nephrotic syndrome is the proteinuria, and whose range is approximately more than 3.5 grams per liters for 24 hours. So this was the background and definition and introduction to the nephrotic syndromes and the formation of the normal urine. So now let's proceed toward the outline of my this lectures. So first I will discuss the definition of the nephrotic syndrome, then the etiology, the causative agents, that may be the primary nephrotic syndrome, primary cause and the secondary cause, and then some clinical manifestation, signs and symptoms that may include the one I have already mentioned, that is the proteinuria and more than 3.5 grams per liter for 24 hours, and the other would be the edema, etc. And then how we can diagnose the nephrotic syndromes, and then the simple management of the this nephrotic syndrome, that is one of the kidney problems. So now let's proceed toward the definition. So in the definition, it is clear that the nephrotic syndrome is a clinical disorder characterized by what? Characterized by the protein in the urine, that is the proteinuria, and the other one is the decreased albumin in the blood, because a lot of the protein albumin is secreted in the urine. Therefore, there will be the hypoalbuminemia and the edema. A lot of fluid will be reabsorbed from the glomeruli and from the different portion of the nephrons, maybe the primary proximal convoluted tubule or the distal convoluted tubule. That's why and the exudation process and the balance between the hydrostatic and osmotic pressure will be disturbed, due to which the edema will result, and also there is excess lipid in the blood. So these are the different main features of the nephrotic syndrome, that is the proteinuria, the hypoalbuminemia, and edema, and the fourth one is the excess lipid in the blood or the hyperlipidemia. Or the nephrotic syndrome can be also defined as the characterized by the loss of plasma proteins, especially albumin, particularly albumin and the urine. So this is the nephrotic syndrome definition. Now let's proceed toward the etiology or the causative agents of the nephrotic syndromes. So there may be either the primary renal cause, or the another it will be the systemic cause. So in the primary cause, there may be either the minimal change in nephropathy, there is the autoimmune disease, and then glomerulosclerosis, hardening of the glomeruli, that will be the another reason of the nephrotic syndromes, and even the uh, immunocomplex glomerulonephritis, that is the attach of the immune system on the glomeruli. So this is the also the autoimmune disease. So the primary cause is different autoimmune diseases like the minimal change in nephropathy and the glomerulosclerosis, or even the immunocomplex glomerulonephritis. So this was the primary cause of the nephrotic syndromes. And the secondary cause, it may be due to some infections, some toxins, or even some allergy, etc. There may be a chance of the nephrotic syndromes, or even due to the cardiovascular problems. There will be imbalance between the hydrostatic and osmotic pressure. You must be familiar with these both pressures, the hydrostatic and the osmotic pressures. Actually, the hydrostatic pressure try to pull the fluid out of the blood vessels, while the osmotic pressure try to hold the fluid within the blood vessels. So these there may be an imbalance between these two pressures that will lead to the severe edema in the surrounding tissue. And this is also one of the main features of the nephrotic syndromes, especially the albumin is responsible for the osmotic pressures. But when the albumin is excreted severely in the nephron, so there will be the deficiency of the albumin, and there will be the loss of the balance of the osmotic pressures, due to which a lot of the fluid will move toward the surrounding tissue, and edema will results. And there may be some due to the malignancies, different types of the cancer is also responsible for the nephrotic syndromes. Now let's proceed toward the clinical manifestation of the nephrotic syndrome. So there are four main features. जिस तरह जो है हमें पता है कि पार्किंसन डिजीज की three main features है, that is the rigidity, tremor, and hypokinesia. These all were the three main features of the Parkinson disease. इस तरह four main features है for the nephrotic syndrome, that is the proteinuria, means the protein in the urine, and then the hypoalbuminemia, that is the decreased albumin level in the blood circulation or even in the plasma. And then there is the hyperlipidemia, the excess amount of the lipids within the blood circulation, and then the edema due to the imbalance between the hydrostatic and osmotic pressure. And how we will diagnose the nephrotic syndromes. So the palpation due to edema and ascites kidney cannot be favorable. It means due to the edema and due to the ascites. So due to edema and the ascites, the palpation on the kidney is not possible, but we can do the urine analysis. That is the hematuria, mean either there will be bloods in the urine or the amount of the protein in the urine will be more than 3.5 grams per liter for 24 hours. This is the main and cardinal features of the nephrotic syndromes, that the amount of the proteins is more than 3.5 grams per liter for 24 hours. So this is the main cardinal features of the nephrotic syndrome. So now let's proceed toward the management of the nephrotic syndrome. That is the final steps. So first of all, we will do the medical management. The goal of the medical management is the reduction of the protein excretion, because that protein is essential for the normal hydrostatic and osmotic pressure, and that can prevent the edema as well as play major roles, because as we all know that the acidic drug bind to the albumin, and there may be the chances of the toxicity when the drug didn't bind to the albumins. So the drug will be in free form, and then the drugs then may cause the different types of the toxicity. The second approach is the causative agent. Is if the causative agent is the streptococcal bacteria, then that can be treated with the penicillin antibiotics. We can also give the prednisolone, that is the steroid, is the drug of choice mainly for the nephrotic syndrome. As we have already mentioned, it's due to primary causes like the minimal change nephropathy or the immunocomplex glomerulonephritis. There may be the immune system is involved that will attack the normal nephrons, and a lot of the nephrotic syndromes and a lot of troubles will result to the patients. So really the dose of that is 2 milligram per kg per day orally for the 6 days in the divided form. And then thereafter, we can also give thereafter 1.5 milligrams per kg a single dose on alternate days for the 6 week, after which treatment is discontinued. So for the first choice was to the reduction of the protein secretion. The second was if the bacteria is involved in the nephrotic syndrome, then they can be treated through the penicillins, and then we can also give the prednisolone. That is the drug of choice, by the way. And then we can frequent relapses are treated through the alkylating agent, that is the anti-cancer drugs like the cyclophosphamide, whose dose is 2 milligram per kg daily for the at least 12 weeks. And then we can also give the nitrogen mustard like the cyclosporine or the levamisole can be also given to the patient to prevent the relapse of the nephrotic syndromes. And then diuretics and salt albumins can be also given to the patient in the presence of edema. Especially diuretics are given to decrease the chances of edema, and albumin is given to maintain the normal level of this protein within the blood circulation. And then we can, especially the diuretics like the loop diuretic, furosemide is given in the dose of 1 to 44 milligrams per kg per day, and two divided doses may be prescribed to the patients. Then the first one was, as we already mentioned, that was the medical management, in which we can give the steroid as well as the different types of the diuretics like the furosemide, or even some other penicillin can be also given to the patients, and the albumin. So that was the medical management. And this is the dietary management, in which the first one, children should take well-balanced diet that is rich in the protein, because a lot of the protein will be secreted in the urines. So that diet should be given to the child, which are rich in the proteins. And then sodium is restricted because it causes the edema, because the sodium will try to retain the water, and that then further can worsen the condition of the edema. That's why sodium or sodium chloride salt is restricted. We can also provide the high protein and high carbohydrate diet to the patient. Also, if disease is an advanced stage, then avoid protein because it affects the kidney, because already the kidney is damaged and there is severe loss of the proteins. And if you take the protein-rich diet, then that will further damage the normal physiology of the kidney and can worsen the condition as well. So, and then the water restriction may be indicated in the extreme cases if decreasing salt intake didn't control the edema. सो ए सिंपल मीनिंग ये है कि अगर साल्ट जो है इसकी रिस्ट्रिक्शन अगर हम करें और फिर भी जो है एडेमा कंट्रोल ना हो, then we can also do the water restriction as well. So this was all regarding the nephrotic syndrome, a short tutorial in which I have discussed the definition of the nephrotic, the causes, primary cause and secondary, the clinical manifestation of signs, symptoms. That was the four main cardinal feature like the edema, the proteinuria, hyperlipidemia, and hypoalbuminemia, and then the diagnosis of the that can be done through the urine analysis, more than 3.5 grams per liter per 24 hour at the 14. So that is the direct indication of the nephrotic syndromes. And then some management of the nephrotic syndrome, that will be either the medical management or the dietary management. And then I have already in the first slide, I have discussed regarding the background of the that what is the normal process through which urine can be formed. That means either the glomerular filtration, the selective reabsorption, and the tubular secretion. I have discussed and give our touch to all these things in a very short way. So thank you all for this professionally listening.